Good morning, everyone. Please feel free to grab your coffee or tea or whatever other stimulant you require, and we'll go ahead and get started. Welcome, everyone. It's really a distinct honor and pleasure to have everyone here this morning, and we also want to welcome those who may be following on the webcast, so good afternoon, depending on your time zone. My name is Ann Kurth. I was the chair of the planning committee for this workshop, and we're really, as I say, thrilled to be able to have this come to fruition and have all of your engagement. I'm just going to set the stage very briefly and cover a bit of housekeeping as we move forward, and we're going to have a productive couple of days here and probably fairly intense days. So again, we welcome all your engagement. For those following on Twitter, we have our hashtag there. There is a website where people can provide feedback. And just to remind everyone why we're here, the big picture, our goal is really to explore best practices and methodologies for evaluating large-scale public health evaluation programs. So let's go ahead and just begin with a little didactically with a few definitions. Large scale, as you see there, over several years time period, large amounts of funding, multinational in its implementation, covering regions, multiple regions, and complex, and I think that's the word we're going to hear about a lot of our discussion over the next few days, really involving different levels of intervention and program, and implementation with a large number of diverse partners. So those are just sort of our definitions to make sure we're all on the same page together. But really the genesis of this whole workshop was the happy confluence of the fact that there have been some recently, and relatively recently, some very major public health program evaluations. And so there was this opportunity, in a sense, to come together and just to explore what have we learned from trying to run these large evaluations. But I do want to stress the goal is not to look back here. The goal is to discuss best practices and move things forward to improve the evaluations that we all do. Now, again, we're talking about large-scale evaluations, but we also wanted to apply to smaller level evaluations as well. The major evaluations that have been done relatively recently that I mentioned here, we are not going to cover them in detail. There is actually in the back of the room and on the website, there is kind of a summary that's a grid that really covers some of these major initiatives, the Global Fund Evaluation, the U.S. President's Malaria Initiative, Affordable Medicines, and the PEPFAR, but we're not going to go into detail. You may hear some examples seeded throughout the next few days as people who are involved with those evaluations bring forward some concepts and case studies, but in any case, we won't cover it in detail, and but the summaries are there. So really our goals are around, again, thinking about how to drive forward a better evaluation for the work that many, many people are engaged in around the globe to improve population health. And we're not going to come up with a single bullet. There obviously is not a single best evaluation design that's going to emerge from the workshop. Every evaluation has to make strategic choices that fit its context and goals. But there are often key strategic decision-making points along the process of designing and conducting an evaluation. As we all well know, there's always trade-offs as well, choices that are made along that route. This isn't necessarily a negative thing, but weighing the benefits and coming up with the best fit for the purpose of the evaluation. So just to talk a little bit about the structure of the day, you have the agenda, which is also in the back of the room or available on the website. We do just have one brief little update. Tanya Marchant will be covering the concurrent session block 1, just as an additional person who's come on board, but otherwise the agenda is up to date as you see it. And what we're going to do is really start with an overview this morning that'll help frame the workshop. Mr. Simon Hurd from the Overseas Development Institute will help us think about the key evaluation and design considerations that will be discussed then in detail throughout the day. We're also then going to have panels, and these are designed around some of the key elements of that the decision and design process. Some of these are going to be interrelated, and there may be some iterative feedback as later discussions in the day may change some of the reflection of the earlier discussions. So this will be a cumulative conversation as the agenda unfolds. And the goal here is really to be candid, open, frank about some of the work that we all have done, again, because we all want to improve evaluations that are done. Conversational, discussion-oriented, feel free to jump in with questions and content. We will have discussions at the end of many of the panels. And the goal, again, is to be solutions-oriented and to apply to future practice. We will then also have some concurrent sessions on day 2, and these will be really, again, trying to talk about some of these same evaluation considerations applied not only to very large-scale global health programs, but smaller scale programs, focusing on different method choices that may be available. You'll be able to sit in round tables during the panels, and it's an opportunity for those of you who hopefully came with a design question or a design problem that you'd like to have your peers input on. That's the opportunity right there at that concurrent session. We will be looking for some evaluative feedback, because it's an evaluation workshop, during lunch on day 2. So hopefully please participate in that over the course of lunch. And we will also be sending a brief follow-up survey to those who are participating both in person today and in the webcast. We'll then wrap up with some final panels. We have some 2 very good sports who are going to take a crack at potential design ideas around a sort of hypothetical or fictional global health program, which we will announce tomorrow with great fanfare. So, and we'll close up then with some final thoughts. And we are going to archive the webcasting and the video that's being taken. We will also have a summary that we'll write up and distribute to all of you who attend. We have your contacts for that. And so you'll be seeing more coming from this. We really must thank deeply our sponsors for this workshop. They made it possible: the Doris Duke Charitable Foundation, the Bill and Melinda Gates Foundation, William and Flora Hewlett Foundation, and the Welcome Trust, who are allowing us to stay in their beautiful space for these next 2 days. So really a hand of applause for all the funders. We're very grateful for the opportunity. And I certainly want to thank deeply the workshop planning committee members, as you see here: Sir George Aline, Kara Hansen, Martin Vesson, Dorothy Morocco, and Jonathan Simon. They were very instrumental in putting all of these pieces together. And we could not have done any of this without the fantastic Institute of Medicine staff: Bridget Kelly, Kimberly Scott, Kate Meck, Charlie Alexander, and Patrick Kelly, who is the director of the Board on Global Health. So thank you to all of our incredible sponsors and supporters. And again, there's the Twitter contact and the website if needed. And I'll just now turn to introduce our first speaker. We're going to keep these speaker introductions very brief. You all have the more extensive speaker bios in the back of the room, should you wish to reflect on them. Simon Hurd is with the Overseas Development Institute and a part of the Better Evaluation Initiative. So, Simon, I'll let you move us forward.
Thank you, Anne, and thank you also to Bridget and Kimberly for inviting me to come, and to the rest of the planning committee. It's a pleasure to be here with you today. It's good to see so many in the room and also those watching online. So as Anne said, I'm a research fellow at the Overseas Development Institute here in London, but I've been involved with a few colleagues around the world to set up what's known as the Better Evaluation Initiative, which has at its heart a framework for planning evaluations, which is quite comprehensive, which I'm going to be introducing to you today. And I hope that by touching on some of the points within the framework, we can sort of help frame this workshop. So I want to start, though, by looking at complexity. As Anne said, this is one of the features that we're looking at in the workshop in the next 2 days. And we're here to discuss the practice of designing and implementing a particular type of evaluation, that is, mixed methods evaluations of large, complex interventions. But what do we mean by complex interventions? Is something either complex or not complex, or is there perhaps a scale of complexity? Well, I want to suggest 6 features or 6 facets of interventions that might vary in their complexity, which I hope will help us to drill down a bit more into what we mean by complexity. So the first 3 relate to the nature of the intervention itself. So are the objectives clear? Are they defined ahead of time, or are they emergent? Do they change and evolve? Is the governance structure, is that clear and defined ahead of time? Or maybe it's actually quite complex and involves shifting responsibilities and networks of actors? And is the implementation of the intervention consistent across geography and across time? Or does that shift and change as we move along the implementation path? The next three relate to how the intervention itself works. Is it the only thing that's necessary for the intended impacts? Or are there other things that are also other pathways to reach those impacts? And if so, are those pathways knowable ahead of time? Is it sufficient to achieve the impacts? Or maybe there's some other factors that need to be in place for the impacts to be realised? And if so, are those other factors predictable? Or can we only know them after the fact? And finally, is the change trajectory, is that straightforward? Can we easily identify the relationship between inputs and outcomes? Or maybe those change over time as well. Each of these will vary depending on the complexity, and we can use these to gauge how complex our interventions are. So I have another question, which is, if we're evaluating this type of intervention, what are the challenges? What does it mean? What makes it different? I want to suggest three particular challenges that we might want to reflect on over the next 2 days. So perhaps our challenge with evaluating this type of intervention is actually just trying to understand what it is we're evaluating, trying to get a handle on the intervention itself. Or maybe it's about getting data on the impact of that intervention. Maybe actually it's quite difficult to measure some of the outcomes, to measure some of the effects. Or perhaps it's actually attributing those impacts that we've observed to the intervention itself. Maybe that process is actually the real challenge in our evaluations. And each of these challenges comes with, sort of requires us, in fact, to expand our toolkit, to think more broadly about how we're tackling each of these challenges and to think about new techniques and new strategies. But that leads us to another problem. When we look at the available methods and strategies out there, we're bamboozled by the options. This is just the page from Wikipedia on evaluation methods. It's just a really long list that just goes on for a long time. What do we do with this? When we're a development agency or an NGO or an in-country government and we're planning an evaluation, or perhaps we're commissioning an evaluation, how do we actually navigate this choice of methods? And how do we do it in a way that's going to be respectful to the methods themselves? There's a lot of guides that are out there, but many of these guides focus on particular types of method or particular evaluation designs. And maybe they miss out some of the newer methods out there, such as geographical information systems and logging on mobile phones and tracking of social media mentions. These things are revolving very quickly, and our guides just can't handle those. Or perhaps there's lots of options and strategies for understanding causality that don't involve experimental methods, and often these aren't recorded in our guides that we have. And a lot of guides miss out a whole section on understanding values in evaluation and actually trying to navigate and establish the values that are going to underpin our evaluation. So when we're faced with these methods, we often lack the information needed to choose between them. So what we can either be is bamboozled by the prospects and unsure of where to go, or we can sort of just fall back and rely on our trusty methods that we've always used, which can lead to some alarming consequences when we try to start with the methods rather than looking and examining the nut that we're trying to evaluate. So in response to this reality, in response to this problem, we've developed the Better Evaluation Rainbow Framework. And it's designed to help navigate between the choices available to us as evaluators and as commissioners of evaluation. the Rainbow Framework is centered around the tasks involved in an evaluation. So rather than jumping to the methods, it actually asks, what are we trying to do in our evaluation? What's our current challenge? What's our current design task? And I'm going to talk through the 7 clusters of tasks. And they're arranged in a rainbow because they represent a diversity, and each is as valuable as the other. They're not a sequential process, but that you can start whichever stage you're at in your design. And manage is over on the side because tasks involved in managing evaluations are pertinent throughout the whole process. And it's like a prism. So I'm going to start with define. This set of tasks is about defining what it is that we are evaluating. And why is this important? Why do we need to start with a clear definition? Well, it's important to establish a common understanding amongst all the parties involved, and to air any disagreements or gaps which can lead later on. So, are we evaluating the oranges or are we evaluating the apples? Or perhaps it's the entire fruit bowl. So are we evaluating the effects on policy or are we evaluating the effects on populations? Or maybe actually our evaluation has to cover all the stages and all the areas. For complex interventions, a good description identifies whether there are multiple components that we're evaluating, or multiple levels of activity, or perhaps different stakeholders involved. And also can identify the multiple intended impacts, and whether there are emergent strategies that we need to take into account. So it's also helpful early on to have this clear description to engage and inform the different stakeholders that are involved in this evaluation. And this is particularly important in complex evaluations where we're having to keep lots of different people engaged and in touch with the process. So within this cluster of tasks, we have 3 particular tasks that we look at. So the first one is to develop an initial description. This might just be a narrative of the program itself, just to get us going. That might then lead to a more detailed program theory or logic model. And then finally, we can identify the unintended results or look at where these unintended results might arise. So just zooming in on the middle one there to program theories and logic models. In the framework, we identify a number of different options for developing and representing logic models, including simple pipeline or results chains, more sophisticated logical frameworks, more sort of structured and free-flowing outcomes hierarchies, sometimes called theories of change, or realist matrices. And for complex interventions, it matters on how you depict the theory of change that you're developing. A simple pipeline probably isn't going to be sufficient to describe the complexity of the different causalities that we're dealing with. So we need to use some more sophisticated methods, an outcomes hierarchy or realist matrix. So now looking at the second cluster of tasks. This is about framing what it is that we're evaluating, or framing the evaluation itself. Framing the evaluation is important, and the ideas around framing come from decision-making and research into how people make decisions. When we're making decisions, we don't just jump straight to the decision, but we have a process that looks at what it is that we're actually looking at. What do we need to take into account? Who needs to be involved in that decision? When does it need to take place? All sorts of questions that we need to have clear before we jump to that decision. And it's the same in an evaluation. We can't just jump to the design, even though there's lots of pressure to get there, and we're all eager to get into the details of the design itself. But we do need to stand back a bit and ask some questions about the evaluation itself. In particular, we need to understand who the users of that evaluation are and what the purposes behind it are. So the framing cluster has 4 tasks. The first 2 are quite related, and where we start is going to vary, but they're about identifying the primary intended users of the evaluation and deciding the purposes and how those users are going to use the evaluation itself. And that's going to really frame what kind of data we need, when we need it, and what kind of level of detail is needed. The next two then feed from that, and they're particularly around specifying the key evaluation questions, something which I'm sure we're all very well versed at, and then determining what success looks like. And this is about the processes and the outcomes and the costs and the benefits, or maybe it's about identifying what standards we're going to use to make our judgments, what criteria are we using to make our judgments. For complex interventions with multiple contributors, there's likely to be multiple primary users, and they're going to have different purposes that sometimes might conflict. So we've got to lay these out ahead of time and to understand who the different users are. They also may have different evaluation questions that we need to respond to and to be sensitive to. They're also going to have different versions of what success is going to look like, and we need to be able to understand what success might look like from different angles, different perspectives, and to take that into account when we form our overall judgment. So the third cluster is called describe. Describe what happened. And this is where we design the process by which we answer the descriptive questions that we have in our design. So what are the activities? What are the outputs that were produced? What were the outcomes that emerged? What impacts can we find? And what context did all this happen in? There's quite a few, as you might imagine, tasks involved in here, starting with how are we going to sample? What's our sampling strategy? How are we going to use measures, indicators, or metrics? And how are we going to actually then go ahead and collect and retrieve that data? Once we've collected the data, how are we going to manage it? What are we going to do with it? How are we going to keep it secure and safe? Then comes the task of combining qualitative and quantitative data. And then the processes of analysing that data, and then finally visualising that data. The analysis and the visualisation are quite linked because you can get quite a lot of analysis through different visualisation techniques. And for each of these tasks, there's innumerable options. And this is one of the most highly dense-packed area of the Better Evaluation website. I'm not going to go through each of these in detail, but I will just zoom in on number 5, which I think is quite pertinent to this workshop. So how can we combine qualitative and quantitative data? The first thing we need to be clear about is why we're combining. What's the purpose of our combination? Is it to enrich the quantitative data that we're receiving with some qualitative data? Or perhaps it's to examine the hypotheses that are emerging out of qualitative analysis with some quantitative analysis. Or maybe we're trying to explain unexpected quantitative results, explain those outliers with the qualitative information. Or maybe it's to triangulate the results to verify or to reject particular results that are coming up. So when we're gathering the data, we can choose different techniques. We can gather the data in parallel. We can gather quantitative and qualitative at the same time, or we can sequence it in particular ways where we do one and then use that to design the next phase which collects data on the other. And once we've gathered it, we can then combine those datas in different ways. So you can have a component design where we collect the data independently and then bring it all together at the end to make a synthesis. Or we can actually integrate it and combine it as we go and use the combination to sort of refine our strategy as we go. So that's just a taste of some of the options available in that cluster. So the next one, number 4, is to understand causes of outcomes and impacts. And this is where we get down to the questions of what is it that caused the impacts, and did our program contribute to those outcomes, and how much can we say about attribution? So outcomes and impacts, the language differs depending on what sector you're from, but they essentially come down to the same kind of thing. They talk about the things that happened either to people, to communities, to the environment, etc., as a result of the project or program that we are evaluating. And if we're not attempting to establish the causal relationships, If we just collect information about what happened and leave it at that, then we can't really call those outcomes and impacts. They're just coincidences, and we can only go that far. But if we're doing an outcome or impact evaluation, then we must deal with causation in some way. And as a profession, we often either oversimplify or we can overcomplicate this process. On oversimplification, I think there's often an implicit assumption that if we've observed something happening, we can just say, oh yeah, it was caused by the program. We can make a massive leap of faith and just leave it at that without really checking whether and doing a scientific analysis to see whether those claims are correct. But we can also overcomplicate things. And a lot of people infer that the only way to do causation is with elaborate experimental designs or very large data sets or very sophisticated statistical techniques. And if we can't do that, then, well, we just throw up our hands and say, well, you know, it's just too difficult. We can't really say whether such and such caused such and such. But, of course, experimental designs are very powerful, and the Better Evaluation site has some good advice on when to use them and how to use them. But there's a lot of other options out there when we can't go to that particular choice. And contrary to this comment that came up in a discussion on the Guardian website in one of their expert exchanges, the commenter here said, in my opinion, measuring attribution is critical, and we can't do that unless we use control groups to compare them to. Actually, there's lots of different ways in which you can establish causation without control groups and without experimentation. And you know, some of the recent work doing this has given us lots more options. And this paper, published by DFID and produced by Elliot Stern, who's actually in the audience, talks through, as well as experimentation, we can have theory-based designs, we can have case-based designs, we can have participatory designs. And as well as counterfactual analysis, we can look at regularity frameworks, configurational frameworks, and generative frameworks. And again, this paper from 3IE talks about, as well as, you know, where we can't use experimental designs in small n interventions, we can look at techniques such as realist evaluation, general elimination method, process tracing, contribution analysis, qualitative comparative analysis. And the Better Evaluation site has 29 different options for understanding causes. So the understanding causes cluster has 3 tasks in it. It has, the first one is about checking that the results support causal attribution. So having a look at the result and asking, you know, is it feasible that this was produced by the intervention itself? Does the timing, does the specificity support attribution? Secondly, we can compare the result to the counterfactual. We can use control groups or comparison groups or expert predictions to do this. And thirdly, we can investigate possible alternative explanations, look at other factors and start ruling out different factors that might have produced the effects that we're observing. So the 5th cluster is about synthesis and about synthesizing data from one or more evaluations. And in this cluster we look at synthesis questions which ask about the overall judgment. You know, given all the data that we're receiving, all the analysis that we've done, how can we make overall judgments of merit and worth of the intervention itself? And some level of synthesis is going to be essential for any evaluation, if it's going to be called an evaluation. Yet it's often missed out of a lot of textbooks and research designs. And there are some very useful methods that we can employ for this purpose. So synthesis, in synthesis we can ask questions like, was it good? Did it work? Was it effective? And we're going to employ some criteria to ask those questions. But also we want to compare this kind of performance data with cost data and to ask, was it value for money? Was it cost effective? Did it succeed in terms of the triple bottom line? And And for each of these questions, we need synthesis methods. So just to give you a scenario, we can look at 4 different interventions, or 4 different components of an intervention. In the first one, in the first column, we see that all intended impacts have been achieved and there's no negative impacts. Though we might assume, yeah, that's overall synthesis is good. And again, in the final column, no impacts have been achieved and there have been some negative impacts. So our overall synthesis might be that it's bad. But what do we do in the middle? What do we do when only some of the impacts have been achieved? Or what do we do when there's been some impacts, but also there's been negative impacts on some other populations? How do we make a synthesis in those cases? How do we weigh up the strengths and the weaknesses of these interventions? We're going to need some strategies for 3 different levels of synthesis: for micro level, for meso level, and for macro level synthesis. At the micro level, we're going to look at performance on particular dimensions and ask, was it successful on those particular dimensions of performance? Is this a good result? Is it good enough? And at the meso level, we can then weigh up the different individual assessments that we've made to navigate through these successes and failures of each dimension, to navigate through the strengths and weaknesses of the intervention, to try and answer some of the evaluation questions that we've got. And at the macro level, then, which might only be relevant in certain evaluations that are trying to ask overall questions about the merit or worth. You know, is this intervention worthwhile? Was it value for money? And in those cases, we need to then synthesize the different judgments that we've made to come up with one overall judgment. So we need some options for each of these, and we need to become more familiar with the different options. One example of where this type of analysis has been done and has been documented is a paper that was published earlier this year by Better Evaluation, talking about rubrics and how rubrics can be used to make judgments and to really define what does good mean in an evaluation, what does good enough mean. So when we look at synthesis, there's 3 tasks. We can synthesize data from a single evaluation. This is what I've been talking about so far, but we can also synthesize across evaluations. And that can help us answer questions like, is this type of intervention effective? Or what variations of this intervention are more effective? And when are they effective? This is the realm of systematic reviews, which I'm sure many of you will be familiar with. And then the third task is to generalize findings. So we may have particular data that talks about a small population. How can we generalize that to a larger population? Or how can we generalize what we found at this particular time to think about what might happen at the future? Or how can we take the findings from this particular country and apply it to another country? And there are methods to help us do that. The 6th cluster is about reporting and supporting use. Why is this important? Well, we are in the business of evaluation because we want those evaluations to make a difference. We don't want them just to be published as a report and for the users of those reports to ignore them or to misuse them, as they are in this cartoon, where you can see the evaluation reports are being used to prop up the desk and to prop the window open. So how can we move from a situation like this to a situation where the findings from our evaluations actually contribute to improved social conditions, which I think, I'm sure most of us will agree that that's what we want evaluations to do. The reporting and supporting use cluster has 5 different tasks that can help us to get closer to that scenario. Firstly, it's about identifying what are the reporting requirements in the first place. Different stakeholders are going to have different requirements about how they want the findings to be presented. Secondly is to develop reporting media. There's, the options go way beyond just producing a report these days. We can produce multimedia outputs, we can produce web-based outputs, social media. But thirdly, we need to ensure accessibility, that those who we're intending to receive and to use our evaluations can actually do so. And fourthly is to develop recommendations, and I think this is relevant in some cases. In other cases, the recommendations are left to the commissioners of the evaluation themselves. And fifth is supporting use, going beyond just delivering our report and actually looking at how can we help the users to make use of these findings? How can we actually get some action out of our reports? And so just to zoom in on one particular aspect of this, and that's infographics. I'm sure many of you have seen a lot of infographics. They're quite trendy at the moment. Every research institute is trying to get in on this act. This is an infographic from 1854, just to demonstrate that they're not a new fad. And this one was produced by Florence Nightingale, and it's looking at the causes of death during the Crimean War. And she collected data on what was causing the deaths and found that overwhelmingly the deaths were caused by not by wounds, battle wounds, but by preventable diseases. And just by presenting this data, it led to an astonishing change in policy, change in conditions in military hospitals, and saving of lives of servicemen. So just pretty impressive from just a diagram. And maybe we can think about how we can present our data in ways that can make an impact. So the final cluster I want to talk about is managing. As I said earlier, this sort of integrates across all of the other clusters and sort of has tasks that are relevant throughout. There are actually quite a lot of tasks. I'm not going to go through in any detail, but the first one is about, for the manager of the evaluation needs to understand and engage the stakeholders. And a lot of the time we're not equipped to do this, and sometimes we're coming in fresh to a situation, and we need some tools to help us try and understand and do a bit of stakeholder analysis and to find new ways of bringing stakeholders together and in a workshop setting. So there's plenty of tools that can help us do this. Establishing the decision-making processes, deciding who's going to conduct the evaluation, determine and secure the resources that we need for the evaluation itself, defining the ethical and quality evaluation standards that we're going to use and having these clear from the outset, and then documenting the management processes and agreements. And then finally is to develop the evaluation plan or framework. And the last two are really the hallmark of quality evaluations, where they review the evaluation design as they go along. They might even use the better evaluation framework to review the process of the evaluation. And finally is to develop evaluation capacity. As we're doing this, we want to be improving the evaluation capacity of our colleagues and our partners and the other stakeholders involved. And there are lots of methods to help us do this. So I've kind of whizzed through the 7 clusters, and I think there are some handouts available. I'm not sure, but if not, they are easy to download. There's a 2-page version which just very easy you can take away with you, and just goes through the 7 clusters and the tasks involved in each. But there's also a more detailed version available that lists the different options available for each one. The website itself is also a key resource, and I'll show you that in just a moment. With all of these options, it can be difficult to know how to make decisions still. So I want to offer 3 tips to help you sort of navigate the framework. The first tip is to look at the type of question that you're asking. Are you asking descriptive questions, such as, was the policy implemented as planned? Are you asking causal questions? Did the policy change contribute to improved health outcomes? Are you asking synthesis questions? Was the policy an overall success? Or are you asking action questions? What should we do differently? What can we do now? And depending on what questions you're asking, you can go to the relevant section and find out what the different options are. Secondly is to compare the pros and cons of each method and option once you've decided on the task that you're faced with. So, for example, if you're looking at the descriptive questions. You can select the task that you're looking for. So you want to collect and retrieve data. Plenty of options for that. If we zoom in on after action reviews, then we can use the information that's there to decide, is that a useful method for me? Some people have already written up their experience of using that method. What helped them decide whether to use that, and how did they then implement that method? And there are all sorts of resources that you can turn to help you weigh up the pros and cons of different methods. And thirdly is to create an evaluation matrix where you might have the key evaluation questions along the side and then the methods along the top, and just asking what methods are we going to use to answer what questions. And then we can try to form a toolkit that's going to cover the best selection of the questions, but also help to triangulate and make sure that we can answer the trickiest questions with the most number of methods. So the website itself has information on the framework that I've presented, but it also has information on a number of different approaches. Now, approaches are packages of methods that cover a range of tasks, like RCTs or contribution analysis or outcome mapping or most significant change. A lot of these methods we're familiar with, but they don't just fit to one particular task, but they are something that we can use that has an underlying logic, an underlying philosophy that might be appropriate to us. We also have information on themes, where we're gathering information on particular types of intervention or particular sectors. We don't have one yet on global health, but perhaps after today's workshop we can work towards developing one. So Better Evaluation is a lot more than just a website. We run events, we sort of run clinics and workshops to help teams work through evaluation design. But for us, that's part of research and development. It's part of actually trying to feed in that information and feed back into the website, where we can use the experiences of other people to help others to learn about choosing methods. And we do a lot of documenting, and so the paper that I showed earlier is one of a package of 6 papers that we use that document evaluation experiences. And finally, just to highlight that Better Evaluation is a global collaboration of many different organisations and institutes. The founding partners include the Institutional Learning and Change Initiative of the CGIAR, the Consultative Group on International Agricultural Research, the Overseas Development, the PACT, the NGO in the States, and RMIT University in Melbourne. And together we've been working on this for 3 years or so, I think. And we've been supported by a number of different financial supporters who share our vision, share the idea that there is this challenge out there and that we need to work together collaboratively to help to produce more information, more guidance on methods for better evaluation. So I hope that this workshop is going to push us further as well. The topic and the structure is very aligned to the values and the principles of better evaluation. And I hope it's going to help fill some gaps that we've got, but also gain some momentum as we work together for better understanding of the richness and variety of methods out there and how we can distinguish between them. So thank you very much. Where are we going now?
Thank you, Simon.
Can I suggest as we get going that some of the backbenchers move forward, because we'd actually like to do this from the table, I think, and without it being raised, it's going to be a bit hard. So while we're getting settled, if the back of the room wants to come forward a bit, I think that'll make it a bit easier for the panelists to address the room and whatnot. As a usual backbencher, I'm going to suggest we get right to it. I'm Jonathan Simon, and my Zambian colleagues have a wonderful practice of just saying, all protocols observed. And through all protocols observed, we will now have thanked the organizers, the funders, and everybody, and try to actually pick up a little bit of time for panel one. Simon, that was a wonderful overview of everything we can do within the complexity of these large, complex evaluations. And I appreciate you starting with complexity, because what I think we're going to try and do in panel one is take that complexity and offer some empirical examples of how we've tried to sort of deal with it. This is an extraordinary group of people who both conduct evaluations, in some cases organize and procure evaluations, but there's a real depth of experience here. So what I'd like to do is sort of frame the panel very quickly in sort of four broad areas, give you a few vignettes of my own experience doing evaluation work, primarily on the President's Malaria Initiative, which is the piece of work that led to my invitation to be part of this exercise, but also drawing upon the fact that we're also evaluating the Rollback Malaria Consortium, the partnership, and have been involved with the evaluation of a number of other large ones. And then I'm going to hand it over to the panelists. You have their names and bios. We have changed the order a bit to give a logical flow to it, and asked Deborah Rugg to lead us off. Chris Whitty will follow with a point of view from the DFID stuff. The Global Fund work will be presented by Ryuichi. Bob Black will continue with his experience as part of the PEPFAR evaluation, and then Carmela will sort of bring us down to the country level as the Ethiopia PEPFAR country coordinator, saying, did any of this make any difference? Does it have any utility or use? So there is a logical flow, hopefully. And let me begin by sort of saying, let's frame it in four specific areas. One, it goes right back to Simon's design and frame clusters in his thing. The second is we'd like the panelists to address the issue of the relationship between the evaluators and those entities that are evaluated. Thirdly, to talk a little bit about the users and the audiences, which is part of the deep complexity to these types of evaluations. And then I'd like to suggest that there's multiple trade-offs, and we talked about trade-offs as a theme. So we're going to try and organize this panel around those four broad sort of themes. And let me kick it off very briefly with some of the examples within those four areas that I've experienced doing some of the malaria evaluation work. It's nice to have a clean design. It's nice to have clarity of questions and which ones are descriptive and which ones are this and which ones are that. And in the reality, when we were asked to do the President's Malaria Initiative, the terms of reference that we received from USG had 82 questions. About half of them were bad English because they were compound sentences, so I think they snuck in about 130 questions in their 82 questions. Last evening at the planning thing, somebody said, oh, that's nothing, John. There was 300 questions on the PEPFAR initial terms of reference. This notion that we have clarity of design and clear focus and purpose, the high-level analysis that Simon was able to provide us is absolutely where we need to go. But in the reality of doing these are usually laundry lists from smart people, passionately committed to issues within agencies or organizations that want to know everything about everything, and they want to know it by the end of the week. Okay? And those are more of the grounded realities that I think many of us have tried to deal with. Now, what did we do with those 82 or 130 questions, depending on where you counted ands and commas in sentences? Is that necessity to prioritize, to group, to structure, to try to bring that complexity into manageable units so that you can actually design the instruments and the frameworks as you so eloquently presented how you might organize it. The second sort of comment I'll make is on this issue of users and audiences. Yes, you're doing an evaluation for PEPFAR or for Global Fund or for Affordable Medicines Facility for malaria. It sounds like it has a very discrete audience. I would argue that the PMI evaluation, and Bernard Nalen from PMI is here, he can ground truth me on this one. We identified at least 4 audiences of importance. One was clearly a political audience, but it wasn't just the Congress who are the financiers of the President's Malaria Initiative, because I actually think the financial audiences are somewhat different. But the Washington Post was an audience. And the think tanks that had been attacking the malaria program in the United States government for years were an audience. There was a huge political audience for this that had very little to do necessarily with the technical evaluations of the interventions or did the intervention work? Yes, or may not be what actually was being played for that audience. Clearly, there was a financial audience. PMI was up for a reauthorization, so there was a desire to have a document that would allow to have a thoughtful conversation about what the program outcomes and impacts may have been in order to deal with the both political but administrative process of refunding. Nominally, the audience was the PMI leadership, but you'll see I've listed them third, not first. There was a keen interest from the leadership in Washington to get a critical external review of what they were doing. I believe there was a deep commitment from that leadership to that. Interestingly enough, by comparison, it was not congressionally mandated as the PEPFAR evaluation was. Admiral Zimmer could have avoided this whole thing. He chose to do it, and that's an indication of, I think, the high-level interest within the organization. So program leadership at the Washington level, program leadership at the 2 implementing agencies, because if you understand PMI, you'll understand that there's a secretariat, but USAID and Centers for Disease Control are in fact the implementing bodies for the President's Malaria Initiative. And I think there was substantive interest at both levels of leadership of those organizations. And let me tell you, it was completely different what they were looking for out of that evaluation. And then most importantly for us as evaluators, there was country level interest, both within the implementing groups on the ground, but most importantly, could we do an evaluation that actually added value or contributed to national malaria control programs? And could the country personnel actually benefit or learn from this? Well, that's a long way from a right-wing think tank doing hatchet jobs on U.S. investments in malaria to the Zimbabwean national program manager. They're not on the same page. Both are very legitimate audiences on this. And that is a huge level of complexity of voice, of outcome, of reporting, of visualization of data, and how it actually gets used. Quickly, a third thing about this issue of the relationship between the evaluators and the evaluated entity. I think I was asked to do this work in part because I wasn't part or perceived to be part of the malaria mafia, right? They were so looking for somebody who wasn't a malariologist, somebody outside of the malaria gang to do it. But let's be honest. I run a research unit at a North American research university. Where does our funding come from? It comes from the United States government. It comes from USAID, it comes from CDC, it comes from NIH. So did I have any true independence as an evaluator just because I wasn't part of the malaria mafia or I didn't have a current grant from PMI? and how we actually manage these relationships and the distance. And one of the useful things that Deborah was talking about last night was the sort of levels of objectivity. We clearly insisted upon what Deborah will call operational independence, right? We got to do what we were going to do. But at the same point in time, we submitted a draft report and got 167 unique comments from our review team, which we then put in an Excel spreadsheet. The evaluation team evaluated each of those comments. In some cases, we accepted and modified. In many cases, it was non-germane, it was an opinion. And in some cases, we rejected. But it was almost like going, for us, the way we chose to deal with that was the same way you would deal with reviewers' comments to a manuscript, where in the cover letter back to the journal, we addressed each individual question that was raised or comment that was made and whatnot. Well, doesn't that mean that the agency affected the outcome of our final report? Absolutely. So what was our level of independence or autonomy at that level of the process? And I think the panelists will deal with this issue of relationship. Part of relationship is the governance structure. Once we had negotiated the scope of work, we said, thank you very much. You now become the objects of our evaluation. We're going to interview you. We're building the instruments. You got to give us 90 minutes in a quiet room, da-da-da-da. We took control of the process once the original framing was done and had a set of agreements on you don't get to see anything until we give you a draft report. Now, at the same point in time, when we had recalcitrant country teams, who do we go to help us line up the country teams? The Washington gang, who we said, we don't want any contact with you in order to maximize our autonomy or independence. So it comes and goes. Last thing I'd like to highlight is this issue of trade-offs. In sort of thinking about this, I identified 7 trade-offs that we made in doing the malaria work, and I'll be curious the panelists and the members of the audience to talk about the trade-offs they see. One is clearly the methodologic trade-off, trying to do mixed methods. What's the right mix of qualitative work? How much quantitative information can you bring to bear? How accessible and of what quality is the routine monitoring program data? How much that can be used or integrated into evaluations? Those methodologic things are clearly a trade-off, and I think Simon spoke well to that. There's geographic trade-offs. PMI was active in 15 countries. We chose to do site visits in 5. That meant 10 were not selected for site visits. They were handled with telephone interviews of a select group of people within. The level of detail between the country and the non-countries is huge, and therefore, do we have a selection bias by the fact that we chose, and frankly, we didn't choose them, we were told these are the 5 countries that will receive. What do we know about the 10 that we didn't go to? Did they refuse because they weren't interested in the evaluation? Did they refuse because they had something to hide? In some cases, 3 of them, they said, why didn't you choose us? We wanted to be interviewed. We have a story to tell. So it cuts both ways, but I think there are trade-offs geographically. There's clearly trade-offs functionally. How much do you look at the decision to do indoor residual spraying versus bed nets? Or is there a general global consensus on those 2 technical interventions? And let's actually look at some new approaches, test, track, and treat, or some of the newer malaria decisions. And how do you get that balance and those trade-offs on what you actually choose to look at functionally within the intervention? How do you prioritize those multiple audiences, as I said, between the political, financial, programmatic, and country-level audiences? There's clearly a trade-off in time between the quality of an evaluation you can do with the time available and the fact that timeliness matters. People want this information. Once they've decided to do the evaluation, it's how soon can I have the outcomes and results so that we can put it into practice or play the politics with it that we do. There's money trade-offs, because no budgets are unlimited in this game. But if you actually think about those 6, they really lump into what I think is this really fundamental trade-off, which is the value trade-off. There's a lot of smart evaluators in this room that can come up with perfect designs, spend a lot of time to get absolutely perfect instruments and apply them rigorously and try to come up with tools that allow us to, make causative or attributed statements versus what's useful information for programs? What's actually program value? And how do you do the value trade-off is, I think, one of the key challenges that we deal with in these large, multi-country, very complex evaluations. So a few comments on my malaria evaluation experience. With that, what I'd like to do is hand it over to Deborah and give you an opportunity from a very different point of view to talk a little bit about how the United Nations thinks about an organized evaluation work.
Thank you, John. And good morning, good afternoon, and good evening to those who are tuning in on webcast. I'm really, really delighted to be at this workshop today. I think the seeds of it were planted about a year ago, and so it's finally come to fruition, and this is a very exciting opportunity, and the diversity of people participating, I think, is going to make for really rich discussions and conclusions. I'm currently the evaluation director for the Secretary General of the United Nations in New York in the UN Secretariat, and have been an evaluator in one form or another for 32 years. It's a long time to watch evaluation methods and fads come and go. And I've worked in academia at the University of California. I worked at the Center for Disease Control in Atlanta for 18 years, and then left the U.S. government and joined the United Nations about 8 years ago, spending 6 years at UNAIDS in Geneva and the past 2.5 in New York in the UN Secretariat. So I've also chaired the HIV/M&E Reference Group, been a member of the Global Fund's Technical Evaluation Reference Group, and currently chair the UN Evaluation Group, which is made up of evaluation directors across the entire United Nations. So I have a broad perspective on some of the things I'm going to say today, but what I've been asked to focus on is the UN current approach for evaluation and give a large context. Almost everything we do is complex evaluation and in one level or another. So I will talk a bit about the office I'm in now and a little bit about my experience with UNAIDS, two UN entities. Trying to address some of these issues of relationship, governance, how we do it, what our trade-offs might be. The department I'm in is the Office of Inspection and Oversight Services at the UN Secretariat. It's responsible for 32 different program entities in the UN. And it is one of 3 major oversight functions for the UN. Our office is actually an internal office because we sit within the UN and the UN Secretariat, but there are 2 bodies that sit outside, and those are truly independent. That's the Joint Inspection Unit, JIU, which is in Geneva, and the Board of Auditors. These are 2 bodies that provide oversight and evaluation service to the UN that are not directly funded by the UN or overseen by the Secretary General. The UN has 193 member states. Those member states represent the boards of all the UN programs that you know and love. They represent the committees that determine our work plan, our budget, and hold our agencies to account. It's the group that I report to. We have over 190 organizations in the UN, so again, complex, broad, all of them with worldwide reach, from small offices like the Office on Outer Space to the UN Development Program and peacekeeping operations. My office is responsible for evaluation support to the UN peacekeeping operations, which is about a $7.5 billion budget. The budget for my inspection evaluation division is about $7.5 million. We have 22 professional internal evaluators that do these evaluations, plus we contract external experts who represent subject matter expertise, because my group is largely methodologists, and we're charged to evaluate everything from peacekeeping operations to the Office of Drugs and Crime, to the humanitarian efforts, UN Habitat, our regional commissions, et cetera, et cetera. So we hire external content experts to help supplement our methodologic expertise and evaluation by providing the subject matter expertise. we report through the Secretary General to the member states, and the member states are like boards. They are, we're mandated to do these evaluations, which makes a huge difference. I was telling colleagues last night that in the past 2.5 years at the UN Secretariat, I've had the luxury of having actual mandates requiring the evaluations that I'm doing, and it makes such a difference as an evaluator when you're operating under an authority and a mandate that's clear, that's funded, and that has expectations that it will be done. Thus, evaluands are participating and cooperating pretty significantly, and that makes such a difference. We are responsible for 32 different programs and entities in the Secretariat that we have to evaluate. We have a risk-based planning approach to who we evaluate. That means we look at a multifactorial set of issues to determine who's up next for evaluations. We do about 8 evaluations a year. We'll look at the extent to which the program has been funded, its size, how many evaluations have currently been conducted, if there's a real need for evaluation, any current topical issues. A lot of the peacekeeping evaluations are based on current political and contextual issues that need urgent attention, as well as the evaluation capacity within that entity to do evaluation. We try to be complementary and value added to the evaluations increasingly. It used to be evaluations in our office were largely for accountability purposes and were not in collaboration with the evaluand. That meant you could be the Office of Drugs and Crime, receive a phone call from us that we would be coming to do an evaluation and when we'd like to come. An extremely non-collaborative partnership model to what we're doing now, much more of a partnership model in establishing what kinds of things need to be evaluated, how we can be complementary and move together to answer questions. And by being much more of a partnership approach, we're finding an increased utilization of the evaluation reports we're doing. The issue of independence is an important one in the UN and for the UN Evaluation Group. It's can be a hot button issue of how independent are you and how free to decide and act and use results are you in reality. And several groups like the UN Development Program, UNDP, does have an independent evaluation group that's like the World Bank's independent evaluation group. These are groups that, while they receive UN funds, report largely to member states, which are independent of the program activity, program services themselves. So it's about as independent within the UN structure as you get, short of a group coming and totally deciding to evaluate with its own funds, own purposes, some kind of activity, or a specific donor or member state directed activity that might be completely independent of the UN. But this issue is very important for us. We see 3 levels of independence: institutional independence, meaning you operate like an independent group outside of the program without an institutional direct line of report. Operational independence means you are within the institutional setting like we are in the Inspection Evaluation Division. We're in the Secretariat of the UN, but we are outside of the programs that we're evaluating. And then the 3rd level is the behavioral or individual level of independence, that you are not you're not being coerced or have undue conflict of interest or biased, or someone is unduly pressuring you to do something. And I have to say, in all my evaluations, I have to prove every single time that we are not unduly influenced by the program, but more importantly to the member states, by any specific country. So we report to all 192 member states. Each member state has equal rights and influence in these committees, and we have to assure that each time we do an evaluation. So we have full operational independence of the programs we evaluate, and with our risk-based planning, we will decide who gets evaluated each year. With 32 programs to evaluate, we're on about an 8-year cycle. So programs can expect, on average, every 8 years for an independent evaluation to come from us. Similar in range to the UNAIDS evaluations that were every 5 years. I believe Global Fund is about every 5 years. PEPFAR is 8 years in retrospect. So 5 to 8 years seems to be a range for these independent external evaluations to be done. And that's reasonable if There are internal embedded evaluations going on that are answering more timely and program-relevant questions. So the trade-off of these large-scale, infrequent evaluations, they can address high-level issues, global context, give an overall sense to funders, but they can't drill down as well as one might expect. So we would like to see more internal evaluation capacity building so that can answer specific questions more on a more timely basis. The issue of use of our evaluations is an important one in how the users use it. And we've made great strides in the past couple of years because we're starting out now with much more of a partnership model. And we spend 3 months in an inception phase where we talk with the evaluand, read all the past reports, understand what's needed, and launch a discussion and develop with them a program impact pathway, like you'll see in the PEPFAR and others, where we sit down and understand how they see themselves operating to achieve effect, and then where they've already done evaluation, where the gaps are, and then where we can zero in to be value add. We do all this maintaining our objectivity, accountability, and operational independence. So I think we've straddled the fence well and walked that tightrope well on being objective, independent, giving accountability results to member states, yet being value added for program learning and program improvement, working with the programs themselves. And then we do, after the impact pathway with the data analysis, we work with them on what we're finding. And then when the report's done, we do make recommendations. We'll do 2 follow-up sessions. And then we come back 3 years later to check on implementation of the recommendations that have been made. And the member states require us to do that. So there is an accountability mechanism that enables the evaluation to be done, to be used, and to be operating in an independent manner as possible. Our studies take about a year. It means we're 3 months inception, 3 months data collection, 3 months analysis writing, and 3 months clearance, and the reports in the General Assembly. That's a short period of time, but the trade-off is we can't go into great depth on a lot of experimental analytic designs we might want, but I think it does give useful results and it's timely for programs. They're asking us even for shorter bite-sized chunks of evaluations, so we're looking to do that a little bit more. Just to wrap up my brief comments here, and I'll be happy to talk in the Q&A after. And in terms of UNAIDS, my 6 years there, I can say just a bit about evaluation. There are 2 internal evaluation staff there that largely in evaluation UNAIDS focus on their performance monitoring. Every 5 years, they're experiencing also an independent external evaluation. And they have a variety of ad hoc special evaluation studies that supplement that, and then an evaluation program of 65 monitoring and evaluation advisors, largely focusing on monitoring, but that are resident in countries and regional offices around the world that work to support the national government's evaluations and capacity building and evaluation, and has received a lot of support and I think value add for AIDS and for that agency. So I'll stop there and thank you and happily expand on any of these. I know these are broader-based issues. I think they asked me to go first because it's a larger context than maybe some of the activities we'll hear about next, but happy to respond to any questions.
Thank you, Deborah. Let me quickly hand it over to Chris Whitty from DFID.
Great. Well, I'm not going to talk about DFID's specific programme. I'll just make a few points, but I hope we'll pick some of them up in Q&A. And I completely agree with all the points being made by our first 3 speakers. I mean, the first thing to say is that everyone in this room shares the view, and actually most people in healthcare share the view, that we need to evaluate and that very good ideas, passionately delivered by people to the highest quality, may not work. That view is not shared by most people outside health. That came as a shock to me when I started to work for DFID, but that is the reality. And most people who actually deliver, who actually make decisions on what gets funded, both in terms of programs and indeed evaluations, are not from healthcare, even if it's a healthcare question. So that is a reality, but it has actually shifted. And I would say that over the last even 5 years, I've seen both in government, bilateral, and in NGO sectors, a move towards people saying evaluations are very important and rigorous evaluations are important. But that battle is by no means won. I think the second very positive thing I would say is that there has been some degree of convergence and improvement in the methodologies we have for doing complex evaluations of the sort we're talking about today, but I would say there is still a very long way to run, and this meeting is a very important contribution to that. I think that, on the very positive side, I think the rather shrill debate between bulgy-eyed extreme randomistas on the one side and extreme social anthropologists on the other has really been pushed to the margins now. It still rattles on, but it's a bit tedious. But I think most people accept that there is a lot, that the great majority of the important stuff is in the middle in mixed methods. But that doesn't mean we've yet cracked exactly how to do things. That said, as a commissioner of, and then therefore receiver of evaluations in DFID, we've seen some examples of outstanding evaluations within the realities of doing a complex evaluation. I would say the AMFM, for example, is an example where we learned a huge amount from it. But more often, I'm afraid, than the excellent ones, we sit around a table being presented to, and you can see the thought bubbles of my polite colleagues above their heads saying, we paid £1 million for this, where you actually, it is meaningless. And the people who are doing it have done an extremely poor job of it. And I think there are a number of reasons for that, some of which are actually on the donor side, and that's what I will mainly talk about, but I think some of which are on the recipient side. And I think the biggest problem from the donor perspective is that there is usually an attempt in commissioning and evaluation to achieve three things which, whilst not incompatible, are very distinct. And I'm going to shotgun a number of the things that were being said in the first talk into three broad categories. The first is assurance to our paymasters, which in my case is the British public through Parliament. And the second is course correction, where people who are actually involved in operating a complex delivery want to have, from time to time, a check from the evaluators to say what's going well, what's not going well, what should we improve. Now, this is essentially a form of good management, but it is actually very different from the first of those. And the third, which is what most of us understand by it if you immediately talk to us, is impact evaluation broadly defined, where at the end of it we can say what's worked and what's not, and what's been cost effective and how can we improve it. And that, of course, is what we'll generally concentrate on. But it's important to understand that people who ask for evaluations are usually, in their minds, in a rather muddled way, wanting all three. And if people ask you for all three, you've got to tell them they're asking for all three and that these are different things, and they're going to A, have to pay more, and P, probably have to do it by at least two different mechanisms. So that discussion has got to be had between the person who's doing the evaluation and the person who's commissioning it right at the beginning and in a very frank way, because otherwise you're going to end up with a large amount of time and money spent on totally pointless activities. It doesn't have to happen necessarily before you've actually won the grant. I accept the difficulties involved in this, but it certainly has to happen immediately afterwards. The second group of problems, I think, are more on the delivery side. And the first is around intrinsic difficulty. What we're talking about here is intrinsically difficult. Many of these things are really hard to evaluate. Our chair talked about there are many experts who could help with perfect design. I do not believe there is such a thing as perfect design for most of the things we're talking about in this meeting. All we're talking about is the least bad we can achieve realistically. And my sort of acid test of this is always, is the answer, if you don't like the answer, are you going to change your mind? Because this is sufficiently strong methodologically that you're forced to change your mind. And if the answer is, no, I'm not going to change my mind, if the answer is not what I want, then you probably shouldn't do the evaluation in the first place. But that seems to me a sort of common sense, in a sense, test of, is the methodology strong enough to hold this thing up? The second provider problem is to do with multidisciplinary providers. Given that we all agree we need multidisciplinary teams, actually surprisingly few institutions have got all the skills needed to do multidisciplinary teams. You very often will find that this university is fantastic at the mathematical or epidemiological side, and this one's got some outstanding health economists, and this one's got some really good health anthropologists, and this one's got some political scientists who can help give context, but you don't have them all in one package. And getting people to work together so you can get the most of all of them is very difficult, I can say very broadly. And the competitive nature of tendering for most public providers, I think, doesn't help this, I have to say. So we usually end up with a messy compromise where you're getting a good bit of this and a not totally good bit of that, retrospectively. And I think sorting that out is something which we as donors as well as providers need to think that through. And I think the third problem, which I think all of us would recognise, but it's actually multiplied to a degree I think is often not recognised, is that most of these big complex interventions are paid for and particularly provided by true believers. And in the case of the very big things, they are usually done by very smart, very politically connected and very charismatic true believers. To take a non-random example, let us say you're trying to evaluate the Millennium Villages project. very important evaluation to do, we would all accept. But there's no doubt that the people who are delivering that believe in it very strongly indeed, and they're very good at actually pushing that. So you have quite a lot of things which actually make it, and everybody, every evaluation has that, but my experience would be the bigger the project, the more complex it is, the more true belief has actually got it to that place. Otherwise, they wouldn't have been able to achieve that much money in the first place. And I think that does put particular problems in the way. So I think it is important when we're thinking about the sort of methodologies, we also think about those practical realities, and there has to be a really honest discussion between the evaluators and the people commissioning the evaluation as soon as the right group has been chosen. And that may involve getting in new people who weren't in the original bid, and it may well involve quite a significant shift in what's being achieved, because otherwise it's a waste of time for absolutely everybody.
Thanks very much, and thanks for picking us up a minute or two also. So with that, let me hand it off to Ruichi Komatsu with the Global Fund.
Thank you very much. Next 10 minutes or so, I'd like to talk briefly about the Global Fund Technical Evaluation Reference Group and 5-year evaluation experience and the new approach. And by that, I hope to address some of the questions for this session. The Global Fund to fight AIDS, tuberculosis, and malaria was established in 2002. It is an international financing mechanism to help programs in countries to scale up programs, interventions that are proven already. And the governing board is a multi-sectoral, and implementing countries are represented by multi-sectoral stakeholder country coordinating mechanism. The Technical Evaluation Reference Group, also known as TAG, is an independent evaluation advisory group accountable to the board for ensuring independent evaluation of the Global Fund business model, investments, and impact. And I see some of the former TAG members, current members, and perhaps future members in this audience. The board at the start of the Global Fund decided to conduct the evaluation to review the Global Fund overall performance against its goals and principles after one full cycle of grants, which was 5 years after its inception. The board approved the launch of the 5-year evaluation under the oversight of the TAG in November 2006. The evaluation terms of reference called for recommendations for improvement. The TAG and board defined 3 study areas to be mutually interdependent. They identified a few focused overarching questions for 3 study areas. Study area 1 was organizational efficiency and effectiveness. Evaluation question was, does the Global Fund reflect its critical core principles, including acting as a financial instrument and country ownership? 2 was, in fulfilling these principles, does it perform in an efficient and effective manner? Study area 2 was effectiveness of the Global Fund partner environment. Question 1 was, how effective and efficient is the Global Fund partnership system at the country and global level? 2 was, what are the wider effects of the Global Fund partnership on country systems? Study area 3 was impact on the 3 diseases. What is the overall reduction of the burden of AIDS, tuberculosis, and malaria? Question 2 was, what is the Global Fund contribution to that reduction? And a synthesis report brought together the major findings and recommendations from the 3 separate studies. It was considered necessary to conduct a large and complex studies for the 5-year evaluation, partly due to a lack of robust information and data management system in countries and baseline measurement. Study area 2 involved case studies of 16 countries. Study area 3, case studies of 18 countries. The 5-year evaluation was valued at $16 million US, including country capacity building component. It took 3 years from initial design to synthesis report. The evaluation was conducted by consortia of organizations to address the broad range of questions. And there are some lessons from the 5-year evaluation. It was a 3-year effort overall, but was a very short timeline for the complexity. The contracting with the consortium, work planning led by impact evaluation task forces created in participating countries. secondary analysis and fieldwork, and preliminary analysis of primary data. There was little time for alignment with the in-country process, such as annual health sector reviews, launching of national surveys, and other data collection or midterm reviews. While generally conducted well, data collection faced challenges in coordination. Study Area 1 coincided closely with the management review conducted for the executive director. Study Area 2 overlapped in several countries with the CCM studies commissioned by the Global Fund Secretariat. Study Area 3 encountered a lack of country health information plans, including data collection efforts. Due to the tight schedule, some impact evaluation task forces formed in countries for Study Area 3 were not fully engaged, which affected the relationship with the 5-year evaluation team. Overall, evaluation identified important areas of improvement. For example, ensure predictable multi-year funding for countries, adjust the demand-driven model, and differentiate approaches to focus its resources to most cost-effective interventions based on epidemiological profiles and country capacities, address the major gaps in basic health service availability and readiness, seek a more coordinated and systematic investment to strengthen the country health information system, develop a risk management framework and segment management of grant, shift to a more partnership-centric approach. Many of these key recommendations have been incorporated into the Global Fund management by now, and also the new funding model which we just launched. So now we are entering a new approach, new evaluation. The TAG has developed its evaluation plan as a midterm review of the Global Fund strategy 2012 to 2016 to ensure the learnings are incorporated. The key focus of the strategy, therefore the key evaluation question also, is impact on diseases. One of the important recommendations was to emphasize continuous evaluation on which comprehensive evaluation can build, and which better inform ongoing grant management at the country level. A large evaluation involving a number of countries all at the same time, as in 5-year evaluation, turned out to be very challenging logistically and less aligned to country cycles. This recommendation has been strengthened in the context of new comprehensive evaluation, described as 5 years of evaluation would be better than a 5-year evaluation. The TAG now emphasizes 5 P principles: partner approach, periodic, plausibility design, country platform, and practical. For example, partner approach means to build on, collaborate, and align evaluation with partners while maintaining and ensuring rigor and objectivity. To evaluate impact of the program scale-up in countries, the TAG has decided to rely on country health sector reviews and disease program reviews as country platform in a plausibility argument. Health sector and program reviews are led by countries in the context of national strategies and assisted by WHO and/or UNAs, conducted by a team of independent experts. Results from such reviews can be practical and immediately feed into the management of grants, especially in the context of new funding model of the Global Fund. While keeping consistencies and quality across various reviews is challenging, the TAG, together with the Global Fund Secretariat, has been working with WHO to strengthen the guidance to the reviews, especially the issue of impact. To evaluate and generate evidence on issues that are cross-cutting and go beyond specific countries, the TAG identifies themes with the input from the board committees and Global Fund Secretariat and commissions independent thematic reviews. It may also consider audit results from the Office of Inspector General to avoid duplicative data collection. The TAG will conduct a broad consultation in early 2014 to finalize the scope of midterm review of the strategy. It will commission an independent consultant to synthesize evaluations of impact and other evidence generated by thematic review and other efforts. So these are the status as of today, and I'm looking forward to discussions and learning from this workshop. Thank you very much.
Thank you, Ruchi. Let me hand it off to Bob Black from Hopkins, who was involved with the PEPFAR evaluation.
Thanks, John. Very pleased to be with you, and I think it's going to be a very interesting discussion. Actually, I'm going to do a presentation because it helped me get organized, and to stick to the topic of this panel, it was tempting to go on and have opinions about many aspects of not only PEPFAR, but other evaluations. And in fact, I'm going to talk about, but not in equal balance, 5 different initiatives that I've been involved in to some or often large degree, and have some comparison, but also my own expression of concerns, and these are personal concerns. These are not conclusions of the committees that I've been on, so take them for that. But these are my own reflections on these evaluations in the spirit of this workshop for constructive discussion of how we might tackle some of these challenges, and I'll discuss these next. Yeah, I don't know if I can click. This is going to be an irritant. Put them all on. Put everything on, because I can't control it from here. So if you put everything on, I'll keep talking in the meantime. So I did a little bit of factual summary of the Global Fund, and put the next column on as well. The PEPFAR evaluation, you have... Keep going. Not sure why it's doing that. Okay. In any case, as I said, I did a little comparison of the Global Fund. We've heard from Ryuichi some of the details about the Global Fund evaluation. I wanted to contrast it in a few aspects with the PEPFAR evaluation. As he said, the scope was determined by the TURG and the Global Fund Board. The time frame from the beginning of the implementation of funding was rather short, and in fact, the 2003-2004 is perhaps not even accurate, because a lot of the funding was delayed coming into country. So at the time of the evaluation, there really was not much time of program. The countries were selected by, as I understand, the Global Fund Board and the TURG. And it was a purposeful selection, but in fact, countries could, and some did, opt out of the evaluation. So again, that raises issues about the generalizability. And the evaluation time frame was rather short, at about 1.5 years. So there are concerns here, one might say, about the representativeness of the countries, about the short time for evaluation, particularly, as I'll say in a moment, with the goals that were laid out, and the short time given for the evaluation. Again, given some of the aspects that were intended as part of the goals. Can we see if the next part can come up? I'm not sure why it's doing this, but that might work better. Let's see. Okay, the other half of this doesn't come up. The other half is PEPFAR, and I'm not sure why it's not coming up. Anyway, the PEPFAR PEPFAR program was to be evaluated, and that was set out in the congressional legislation. So the initial scope was defined by Congress. The time from the onset of the funding of PEPFAR in 2003 up to the ending of the evaluation was 2012, so a more substantial time, although more focused on the latter part, the latter 5 years. The evaluation was for the whole of PEPFAR, 31 countries. There were 13 countries visited, And it's a distinction between the Global Fund and PEPFAR. For the Global Fund, it was really a country focus, and the countries selected had information provided. For PEPFAR, it was, as I say, the whole of the program, but the individual countries were not identified, the data from those countries not presented, and there was no feedback to, to the countries per se. The evaluation timeline was longer. It was actually 4 years, and that may lead to a conclusion that was really a long time, especially in a program that was evolving. And so as it was changing, it was hard to keep track of all the changes and be thorough about the evaluation. Let's see if I can go to the next one. Okay. For some reason, some things are skipping out, so I'm not going to go to this one yet. So the comparison of the goals of the Global Fund program and PEPFAR, I think there were some major similarities. For the Global Fund, it was certainly on the performance of, in this case, the 3 diseases, the programs for the 3 diseases, access to services and coverage, and changes in risk behavior. For PEPFAR, it was also performance of the programs, even more specifically, progress toward prevention, care, and treatment targets, and effect on other aspects such as health systems. There was for the Global Fund an intent to assess the impact on, as it was called, the disease epidemiology, morbidity and mortality, and for PEPFAR also an intent to look at aspects of improved health, the 5-year survival rates, HIV incidence, child health, a number of aspects. Both of these evaluations developed program impact pathways, as Deborah mentioned, and I think it's for a discussion as the workshop goes on to what extent these program pathways could be used based on available data, time frame, and other aspects. So I won't get into that now, but clearly there was an intent to do it, to go from the inputs the whole way through health impact. And I think we've already heard in some of the previous speakers about contribution. I think in both of these evaluations, there was a lot of discussion about attribution, direct attribution of funding to effects, health and program effects. That came up. That was magic. And I didn't do anything. But I think in both cases, the conclusion was that to take a contribution model for Global Fund. This was primarily related to the relative financial support, and for PEPFAR also relative financial support, but there were other areas where it was very obvious that the predominant funding came from PEPFAR, such as laboratory strengthening, where there was hardly any other funding coming in. So let's see now what happens if I go to the next one. I can't do it. Can you advance? We'll see. Okay, let's go to that one. Yes. So as I said, I wanted to talk about some aspects related to not only Global Fund and PEPFAR. I'm going to jump to the evaluation aspects. As we heard, the Global Fund evaluation was a consortium of 5 institutions. It was an international tender and a reliance on country institutions for data collection. Funding was from the Global Fund. PEPFAR Institute of Medicine was asked to do this by Congress. There were 2 different committees, one for planning, one for implementation of the evaluation, and the funding was through PEPFAR. The Integrated Management of Childhood Illness evaluation, the multi-country evaluation, and at the time, this was the IMCI was an approach to managing severe childhood illness. It was being initiated in 60 countries at the time this prospective evaluation was launched. By the time it was over, it was in 100 countries. So a major international initiative, largely through the WHO and to a degree UNICEF. And in this case, the implementing agency, if you will, the UN agency responsible for it was also responsible for the evaluation. And it did have a very strong Advisory Committee. The funding was from Gates. Accelerate Child Survival and Development Initiative program was in 11 countries in West Africa. It was also looking at, as was IMCI, both feasibility, quality of care, cost, and child mortality. And it was, I would call, a selective primary health care approach with aspects of antenatal care, IMCI, and immunizations and vitamin A. In this case, we were contracted by UNICEF to do an evaluation, a retrospective evaluation. In fact, to do some confirmation, as they hoped, of their claim of mortality reduction in selected countries. So we were asked to do it in selected countries. The funding was from Canada, but through the implementing agency, in that case, UNICEF. Millennium Villages, which has been mentioned a moment ago, is another initiative in 10 countries. The evaluation is to look at feasibility, cost, achievement of all of the MDGs. And in this case, the project has decided to do its own evaluation very late in the game at year 7 of a 10-year program of work. An advisory committee was established, and project funds are to be used for evaluation. Finally, the concerns. So one is the global fund. I believe that there were compromises in regard to country ownership and the objectivity and independence of the assessment, and between the rigor and timeliness and capacity building aspects. So these were trade-offs. I think in regard to independence, there was an independent evaluation consortium, but the data largely came from implementing agencies, or a heavy amount of it. For PEPFAR, I think the inability to use the results at country level were limiting, and I think, in my view, unfortunate. I don't know that I would have, in retrospect, designed an evaluation that would not provide any information back to individual countries. And as far as independence, I think the Institute of Medicine is very strong on and having no conflict of interest among committee members. The process was developed and carried out very, very independently. And in fact, the report was not given back to the sponsor until it was absolutely finalized. It was a very extensive review by experts, and as John described, a thorough response to that, but the sponsor did not comment on the draft report. So it was very independent in that sense. However, there was no new data collection, and therefore we were relying largely for the quantitative data on the data from the implementing agencies. The qualitative data was independently collected. For IMCI, I'm going to say this very quickly. I know I have to wrap up. The selection of the IMCI countries for evaluation were those selected by the program at WHO thought most likely to have strong implementation. It didn't always turn out that way, but the emphasis there was getting the health impact. So to get the health impact, you have to have strong implementation. Therefore, the selection of countries were those, in a way, the best case ones. And there were a number of aspects of how to keep the independence. The advisory committee was one. Agreement on country leadership as far as the publications was another. The ACSD, I would just say quickly, in this case, the selection of countries was based on those that were already claimed by UNICEF to have a mortality impact. The fact that the independent evaluation did not find that made us very unpopular, and therefore there was a great degree of discomfort with the independence of the evaluation. The Millennium Villages, I'll just say there is still much concern about the evaluation being done by the implementing agency and the role of the advisory committee, which I chair for full disclosure, is evolving. I think we've had a good degree of input, but the evaluation is still being finalized and planned. The conclusions, I would say, all of these programs had the intent of measuring both program performance and health impact, which I think is a good thing. However, the feasibility and the timeline for this needs to be questioned and I thought through very, very thoroughly. There are a number of aspects related to the country selection that may compromise the generalizability, representativeness, and also relate to data availability. And I do think, as I said, we should have some obligation to provide feedback to countries if that's possible. And I know there's a trade-off, and I think we can discuss that, of why OGAC and the IOM decided it was better to have it as a program as a whole without individual countries represented. And I think there are advantages to that for, possible candor and confidentiality issues. And the issues related to funding of the implementation, I think, need to be thought through very carefully. I think almost all of these have examples of some kind of conflict, whether it's in the selection of countries or the direction and design of the implementation or the interpretation or the control of funding that limits what kind of evaluation can be done. There are many, many aspects, and I think all of the examples that I've seen, the funding comes from the program, or at least is linked in some strong way with the program, which really, to me, compromises independence. Thank you. I'm sorry.
Thanks, Bob.
Time.
Let's quickly move on to Carmela Grinabate, who brings the perspective as the PEPFAR country coordinator for Ethiopia.
Thank you, John. How many field practitioners here? Because I feel a bit outnumbered, I think. And I'm hoping on the webcast that there are more field people. But are you all evaluators? Yeah. So I'm definitely outnumbered. But I would like it to take you back down to the passion that we actually are affecting people's lives, because that's where I'm coming from, and how we're using and how we've used the PEPFAR evaluation from my perspective. And I've actually was involved with contributing to both the first evaluation and the second evaluation. So I've seen the journey that PEPFAR has made, and I've absolutely no doubt that the independence of the IOM evaluation has not only affected the funding, but has also affected the whole journey of PEPFAR, because I really do think that when PEPFAR started at the beginning, it was all about getting pills out to people and getting people on treatment. And the first evaluation then highlighted that there needed to be more focus on prevention. The second 5 years of PEPFAR actually moved from getting pills out to people, which was equally important, but a focus on combination prevention, and how important that was, because otherwise we would have such a large mortgage to deal with that this would not be sustainable. Also, I think that at the beginning, and for those who have been involved, the importance of developing health systems was really not appreciated. And about 3 years, just around about the time of the first evaluation, the importance of having a system that delivered the complexity of what is needed to get AIDS treatment out also changed the focus of some of the funding, and it also changed the focus of some of the global funding when they realized that in order to get pills out to people, you actually need health workers, and you need supply chain, and you need to monitor what you're doing. So I think that was also key. I would agree with Bob. Very frustrating that there are no country-specific examples. Very frustrating for me. And I think that going forward, I think that there are opportunities, and I think the documentation of best practices has suffered because of that. I think that there are opportunities remaining in line with the anonymity, also to put in country-specific examples, because in the second evaluation, they're saying, well, where are the best practices? And the best practices are not there. And I think that it was very interesting that Congress mandated that there was an evaluation, and I'm absolutely convinced that this is how there has been ongoing bipartisan support in an era where resources are dwindling, and we've just had now the third. It's not called a reauthorization; it's an act, right? It's the Stewardship and Ownership Act. It's not exactly the same as the first two authorizations, but I don't think that without these really independent evaluations that Congress would have continued to fund at the same level. It's one of the few programs that has not had a decrease in funding. The other point in the second evaluation was the emphasis on knowledge management and monitoring and evaluation, innovation and research. And this has actually now led to a new monitoring and evaluation framework that is still being rolled out, that from the field presents me with enormous dilemmas, because we now have there's a demand to monitor at different levels. You have to measure direct and non-direct, and this is part of the new bill. But the speed of the rollout is such that we really can't negotiate at the country level. So the issue of timing, and that's been brought up by a number of different people, is really very difficult. And if you really do want country ownership, you need to have time in which countries can change their health management and information systems in line, and not have different systems. Because if you remember, PEPFAR sort of parachuted in as a very vertical program, and now in order to get country ownership, it has to be much more integrated. And putting this, you're again parachuting in a monitoring and evaluation framework that's going to be very difficult to align with countries. And so I don't know whether anybody on the webcast are actually from countries, but I see this as a real dilemma. The other question that I was asked to address was, why is it important to increase evaluation capacity at country level? And I do not. I've been in Africa for a long time. Probably, I've practiced in Africa for 40 years, and I don't really see an increase in evaluation capacity at country level. This is, it's a business, and so in order to so I really do think that the documentation of best practices which actually happen in the field, and the sharing of program results and dissemination, should take place at country or at regional level. I think that the dissemination of this report, 850 pages, but there are summary pages, which are really good. You can read the summary pages, but all the dissemination has taken place either in the US and a little bit here. But it's very, very relevant at regional level, and I really do think that this dissemination has to take place, because otherwise you're not going to expand the research capacity, primarily within Africa. If you look at trials, they're not led by Africans. If you look at initially, PEPFAR had implementing partner meetings; those have now dropped off. So we talk to ourselves, quite. Not very frequently, but PEPFAR also doesn't support participation at scientific meetings. So how can you expect country-level capacity to increase? So I would suggest that there is a greater need for African-based scientific conferences that are of high caliber. Just because it's in Africa, there should be, the caliber should be as high as anywhere else. And that these should be linked to some of the themes that the PEPFAR evaluation has actually focused on, which is exchanging information and identifying best practice. And I thought initially when we started PEPFAR that there was this fantastic opportunity to do multi-country research. I think that has not happened. And there is so much information. This has been such an exciting, successful program surely we could learn from it. And so why hasn't this happened? The other important issue about academic and research opportunities is that it really is a way to retain faculty within countries, because it's very difficult for people to get motivated, and research is one way to do it. And I would suggest that the US and the US government is in a unique position to actually now move forward in the third phase of PEPFAR to really support the opportunities for innovation research and evaluation at regional or country level. I would like to just take it down even one lower level and talk about the fact that one of the few targets that hasn't been addressed is that of children. And I'm a pediatrician, so I've got to talk about children. But it's interesting to me that PEPFAR, one of the hard earmarks that's remained in the last for the last three phases, has been the earmark on orphans and vulnerable children. Yet, we have not reached any of the pediatric targets. So what is why has this not made a difference? And when you look at some of the research, if you try and link it with some of the research, at the ICASA conference in 2011, which there were out of all the abstracts that were submitted, 13% addressed pediatric HIV infection, and only 3% of those, of the oral presentations, had anything to do with children. So is there a link between the fact that we haven't met targets and we haven't actually had any research, and that some of this research should be done at the field level? I'm happy to answer other questions from the field level, and I'll stop there. Thank you.
Carmela, thank you very much, and I want to thank all my colleagues on the panel for their thoughtful comments. What I'd like to do is highlight the latest trade-off, and we're going to, with the IOM staff permission, we're going to trade off a significant part of the coffee break so as to maximize the amount of opportunity for Q&A. So with that introduction, let me open it up to the floor and open it up to the people listening by webcast to address their questions to the panel. I'd only ask, given respect for others and the amount of time available, that you keep your comments brief and your questions sharp, and I'll ask my colleagues on the panel to try and be pithy in your responses to the questions so we can get as many comments as possible.
And if you could also just say your name and the organization that you represent before your question, that would be very helpful.
Well, thank you very much. Lieve van Heteren, Director of the Rotterdam Erasmus University Global Health Initiative. I'm very happy with Camilla's last remarks, actually. I have a question to you. Posing the question might be also answering them. I mean, you say you have been 40 years in Africa and you pose some pretty fundamental questions. So what should be the next step to actually deal with those?
You can take a couple of questions, John?
Sure, let's take another one and then we'll give you a shot at that, Carmela.
I'm Shungita Mukherjee from, is it on? George Washington University. So there's been a lot of talk about the independence idea, and you've talked about levels of objectivity, and Deborah talked about different components, or I was thinking about functional independence, and I was really thinking about, as evaluators, there was the independence of the data sources, where the data was coming from, but what about analysis and interpretation? How do we ensure independence, or that there's objectivity in that process so that we have the confidence in the findings to push for the program changes that Christopher Whitty talked about?
Take one more.
Hi, Barbara DeZelduando, recently UNAIDS, but now independent, retired. I'd like to ask, I guess, Bob Black and Deborah and Ryuichi to say a little bit more about why the two greatest sources of program information that have ever been created, i.e. the planning databases for both PEPFAR programs and the Global Fund, why they are not more used in evaluation research for multi-country studies.
Carmela, why don't we give you that first shot at the classic what shall be done question?
There have been some, I think it's based on academic links, but academic links on an equal partnership. And for example, I'll take the example of the Medical Education Partnership Initiative, which is funded by PEPFAR. It's a $10 million program in which the focus of the program is actually the principal investigators are the African institutions, the African universities, and the subcontractors are the US-based universities. And by putting the African institutions in the driving seat, I think that this has the potential to improve research, to retain faculty. It is really discouraging when you go, how can you expect programs to be run in Africa when all the people are being drawn out to the US? I mean, we've got to try and retain. There's some excellent people in Africa. So I would think initiatives in which the African academic institutions are in charge, and with academic links to both, to the rest of the world. I really think that there's an opportunity. Best practices have to be rigorously addressed. It's not a best practice is not just best practice because you feel like it today. There are criteria. So I don't think that we've done well enough on that. There needs to be opportunities for grants that are easy to apply for. I think I'll stop there to be pithy.
Okay. The question of the independence of analysis and interpretation. Anybody in particular want to try and tackle that one, Bob?
Well, I think in the example of PEPFAR, there was complete independence of analysis and interpretation. I mean, given that some of the data had to come from the program, still the interpretation of that was independent. As I said, there was extensive review by outside experts, some of whom actually could have been involved in the implementation, unlike the committee that could not have any conflict of interest. There is, though, a trade-off, and I think the PMI evaluation is the other example. We're giving it to the program and then being able or not to respond may actually inform that evaluation. So independence, I think in general is good, but we ought to recognize there may be insights that the program has that the evaluators can respond to that might be legitimate. One other, just a comment back to Brazy, a response. For the PEPFAR evaluation, there was very extensive document review. The country operational plans reviewed. They are massive documents. Over a 10-year span of PEPFAR, with documents that are sometimes 1,000 pages in a given year. I mean, this, it's very hard to come to grips with all of that information. But there was an attempt to mine that information to the extent possible.
Chris, you wanted to add something on this point?
Yeah, just going to make a couple of comments on each of those two questions. I mean, firstly, on the issue about Africans being involved in Africa. I think let's differentiate between the many outstanding African individuals and the rather smaller group of African institutions. And I think it's important. We need to build up the African institutions, but there are already African scientists who should be able to be at the forefront of doing this kind of work. And I think, speaking from a DFID-specific perspective, one of the very disappointing things is we frequently will get in, because people know we care about this, applications that list 3 Americans and 15 Africans, and we think, fantastic, this is going to be a mixed thing. And then the publication comes out at the end, and there are 3 names, and they're all American. And the fact that people do not properly involve their African investigators, having promised to at the grant-giving stage, is, I think, something which we should all feel deeply ashamed of, frankly, for the reasons that you gave. In terms of independence, clearly there is absolutely no point in having an evaluation unless you trust its results, and you're not going to trust its results unless there is independence, both of the evaluation and of the synthesis and interpretation. But, and there is a but to this, complex things that the ones we're talking about at this meeting also are very difficult for outside people fully to understand the complexities of. And they're going to have to engage quite heavily with people on the ground who are working, or they're going to misunderstand a lot of the data which they've actually collected. And getting that trade-off, to go back to your first thing, right, I think is one of the most difficult areas around independence in these areas. But it's got to be achieved. If you go too far in either direction, you're going to fail, basically.
Other comments on those two, or can we take Brazy's or Ryuichi?
Sure. For the Global Fund, we started to change the way to give funding to the countries. What we are asking the countries are to use the national strategy, either health broader health or disease-specific national strategies, and use the end of the strategy term or the midterm review to look back what's been working well and what are the change in epidemiology, and based on that to request the future funding, future programming, future and the necessary funding. And we like to use this as a basis for the evaluation for future, so that where the data may be not independent, but still there's objectivity together with WHO or other multiple actors in the countries, and interpretation can be independent from the independent synthesis of all these reviews. So that's how we are thinking right now.
Brazy raised the important question of, we have these huge global public goods in these databases, and why aren't they being more used for research in general or cross-country comparative work in specific? Does anybody want to tackle that or just accept it as an observation? I'll comment on it. Of the 5 technical recommendations within the PMI report, the one which is most critical was of the organization's misuse of the research opportunity that the rollout of PMI created to do exactly those kind of learning laboratory and a large-scale implementation for malaria. So we observed the same thing you commented on, Brazy, and actually made it one of our 5 technical recommendations in the PMI report. Any other comments? Let's open it up for more questions. George?
Two quick questions. I'm George, member of the Planning Committee. Once upon a time, we used to talk about evaluability of programs. Are programs really evaluable? At the beginning of your programs, you sort of say, look, this program is not evaluable. Throw up your hands and say, forget about it, if it did not meet certain criteria of being evaluable. I'd like to hear your comments about that, because it seems that from your comments, every program is evaluable. One. The second point I'd ask is, the UNDP will never come to an end. You're never going to get evaluation. UNDP says, look, shut down shop. Where it is theoretically possible that you could say PMI, shut up shop. But you seem to deal with these two different animals in the same way. Is there some fundamental difference you would like to draw?
Question over here.
Yes, I'm Lori Heisey from the London School of Hygiene and Tropical Medicine. I'm wondering, I mean, we're talking in terms of complex programs here, specifically programs, as opposed to complex interventions. And I work in an area where we're trying to evaluate in small and kind of community randomized trials things that are very new, you know, community-based alcohol interventions, preventing domestic violence, those types of things. And our biggest problem is that we're now in a realm where we're being asked to evaluate programs that are not ready for prime time. And the issue of independence, to me, comes up because in that idea of trade-offs, we almost would be better served at that, or I would argue, and I want your reflections on this, at the early stages of developing novel interventions to have less independence between researchers and evaluations and program designers and implementators versus more, so that you're actually refining the program and then evaluating it as a partnership. And I see the concern about independence sort of somewhat getting in the way of that type of model in areas where we don't know yet what to do. So I'd like your reflections on that.
We'll try to address that. Do we have one from the webcast before we lose our Q&A? If not, I'll take one more from the floor. Nothing from outside? Okay, then a third one from the floor.
Sanjeev Shree from the University of Toronto. A few of you have talked about the problems of timelines, both the timelines of implementation and the timelines of evaluation. What I didn't hear were concrete ideas of, given the fact that most complex initiatives are not hitting miracles overnight, what are sort of tools that evaluators have to offer, not in a sort of post-hoc looking backwards kind of way, where a report is due next week and not enough time has elapsed, but how would you actually bring a little more progressive thinking that these are longer term initiatives and bring more navigation into the actual implementation?
Great. Let me open it up to the panel, and I'm going to actually pick on you, Deborah, given that you have 32 organizations in your mandate. Are all of them evaluatable?
Thanks. Happy to address some of these questions. Are all of the, well, that sort of combines a couple things. The evaluability question, an important one, and I think evaluability assessments were frequently done, fell out of favor, are beginning to be done again. I think it's a good question to start with always, because it's about resources and the best use of resources. And as resources dry up, evaluators, like anyone else, have to talk about, is this the best use of our money at this point in time? I know half of the evaluative assistance activities I've done before my current job, I would say half of them were best done as management consultation and not an evaluation. In other words, they weren't ready for an evaluation study to be done. And no, you don't need independent external evaluative summative activity when you're doing formative research. That should be embedded in the program side by side with the people who are innovating and creating some of these program components. The evaluation should feed into that and use the methods that allow for that, and does not require an extremely independent arm's length. It should be a partnership, I would say, on that. And the evaluability of in UNDP versus PMI, yeah, very different, but we're not seeking to end assistance, development assistance. So that's not the point of that, the evaluation in UN Development Program, UNDP, or any of these big entities like WHO. Are we seeking to end WHO? No. I mean, maybe some of you are, but we're asking key questions about how to do it better, how to know if what we are on the right path to make a difference, if it is actually making a difference. And I would submit that after 40, 50 years of evaluation capacity building or other capacity building in Africa, if we're still not making a difference, we're not doing something right. And we should drop back and have out-of-the-box thinking about how to do this differently and really evaluate that. So that's combining a couple of questions right there. I guess that's, yeah. The timelines on evaluation, what I've seen in the different roles I've had is that I sort of operate in 3 parallel universes. And what that means is I have to respond by COB by the end of the week, by the end of the month, and then when the study really is going to be over, which could be a year, or in some of these studies, a multi-year endeavor. And that if you don't have information ready to provide information to the information needs and the information beasts, whoever are asking for that, it will interfere with the ability to do the other levels of evaluation well. So if you're designing a 3-year study and you don't have information that can be available on much shorter time frame, it will challenge your ability to continue and challenge the utility of the longer term study. People will have moved on before you're ever finished, and I think that's a real risk for evaluators. Certainly in the PEPFAR evaluation, it was a long evaluation time frame, and in such endeavors, I think we need to have a game plan of how do we feed important information in a very timely way, frequently, and then maybe a midpoint way, how we feed information, and then finally the end point, giving the results. And if you do that, I think then there is much more, it's more palatable, and it's meeting the needs of multiple information requesters.
Deborah was good enough to touch on all 3. Other panelists that want to speak to any one of the 3 questions? Chris?
I'm not going to take the second because I think I had a crack at that earlier, but I'd like to pick up the timeline point, but also the point about evaluatability. I mean, evaluatability is rather like drug resistance. It's not actually a yes-no thing. It's a spectrum from the really pretty obvious what we should do through to the this is going to be very difficult and beyond. And I completely agree with Deborah that where you put the cutoff will depend on your resources and the importance of the question. And that would be my second point. There are some things that are easily evaluable but probably not worth evaluating, largely because they're not going to be done again. So that even though it may be a major program, it's not obvious what lessons usefully are going to be learned from that. So there are clearly multiple factors that need to be taken into account when deciding which of the things you could evaluate you do. But clearly evaluability in a spectrum sense is one of them. Of course, there is a difference here between evaluation to work out whether it's worked, where I think what I've just said applies pretty clearly, and evaluation to assure the public that money is being well spent, in which case you essentially have to do your best almost in every situation if you've got a very large programme. You can't say to Congress, to Parliament here, to Mr Gates or someone, look, well, you've put a lot of money in here, but we don't really know it's going to work and we never will. I think that's not a politically acceptable answer. In terms of timelines, I mean, I think we all recognise the point behind that question. I think the one thing I would say is that that people often try and think in grand terms of let's work out whether this has worked or not worked, rather than look about evaluating subcomponents or particular questions within a much larger scheme. And very often when you're doing that, you can, within the timeline you've got, plan ahead, because most complex interventions have multiple interventions that are brought in different places at different times, and they do actually allow certain sub-questions to be answered quite well within the timelines, even if you don't have the luxury of actually being able to plan it right from the beginning and evaluate the whole thing as a package. And actually, the whole thing as a package often is not the correct thing to evaluate in any way.
Ruchi? Thank you. So one thing Global Fund has been emphasizing over the last decade was to invest 5 to 10% into the monitoring and evaluation. 5 to 10% of funding Global Fund is providing to the countries is quite large. We disbursed more than $3 billion last year only. And it is inevitable to strengthen the data system. And that is for evaluation, but also for the monitoring and management of the program. So that's quite important. And in terms of timeline, if you start from a large-scale, complex, multinational global health initiative and question for that, it becomes quite tight timeline. But if we encourage countries to continue evaluating their programs and build the cases based on country-level evaluation, then it becomes, we think, manageable to answer some of the global questions.
Carmela?
Maybe
and
I could just make
Bob, we'll come back to you. Sorry, I didn't see you, Bob. But Carmela?
This is probably sacrilegious in this audience, but to me, monitoring and evaluation are two very different things, and they're always linked together. Monitoring for me is something that we can report very quickly. We can get results, and I think PEPFAR did an extraordinarily good job of doing this. It was very target oriented. It's not impact level, but in every 1 year, we could actually say exactly what had been done, how many people had been reached. To me, that'll address the time issue. Evaluation is is a higher level, and it is a different purpose. And so I think that maybe would address some of the two questions that came up about how we can get results quickly, because I think PEPFAR actually did succeed, and that was from an implementing partner point of view, and then from the US government point of view, where we collate things up. How we use that data is how the team uses it. I mean, data is only good as how you use it. So if a country, if you were looking at a country program, if you can feedback that information and actually use that at that level, that's where it should be used, and then it moves up, and then there's a different level of usage. So I'll stop there.
Bob, next word, and then we'll try to wrap up for coffee.
Well, I think much has been said already that I was going to add, but in terms of the evaluability and time frame, we teach our students that there's a stepwise process that, you have to first be sure there is a program in place before you look for health impact. And yet when we accept the terms of reference from some of these funding agencies, we don't do that. We conflate them, and we try to do both at the same time. So if we're really doing this prospectively, I would say almost any program that is worth doing is worth evaluating or monitoring. I do respect there are differences, and so getting information to improve the program is important. I think in any program, and it doesn't have to go to mortality impact or health outcome. I think the Affordable Medicines Facility for malaria is an example of an evaluation that actually provided useful information about the availability of the drug. it didn't even go to use, let alone health impact, but it still provided useful information. And I think that's, I think we shouldn't always jump to the health impact, because that's where the time frame and the program implementation and many other aspects are going to compromise us and get us in trouble.
Deborah, I'm going to give you an opportunity for a last word, and then give the other panelists a summary sentence if they so wish.
Thank you, John. Just to add one clarification addition to what Bob's saying about monitoring data, and yes, what Carmela said, it's certainly different. And in the M&E field, it was always the big capital M, because it was easier to do, and anybody and their brother could do monitoring, but evaluation was much harder and always short-changed. And however, there still was a lack, and remains a lack, of good program monitoring data. And in the conflicting situation of having reams and reams of program information that we see from some of these initiatives, like PEPFAR. And so to me, the real distinction is, yes, program monitoring data is important, but you have to know why you collect every single piece of information. And if you don't know why you collect it and what you're going to do with it, do not collect that monitoring information. Now, I don't think that maybe 10% of the information that PEPFAR has in its huge databases is used for program management decision making, and therefore I think it's hard pressed to show the value add of the money that goes into all that program monitoring. And conversely, the evaluation studies that have been done, and this is one of the weakest areas we've seen in the PEPFAR initiative, is the operational research public health evaluation, and the decade of missed opportunity to do specific program evaluation studies that would have formed and been more in the operational category and advanced a lot of intervention trials without all of the independence and the big scale studies and the waiting 5 years. So my long sentence is that it's an interesting conundrum that, in fact, we have a lot of monitoring data, but it's not being used properly. And don't collect it if you're not going to use it. And it was at the expense of still doing better evaluations, as John started out with. We need to do evaluation right, and it's time to not accept the status quo anymore.
Thank you. Other last words from panelists? Chris, anything to add?
I agree with Deborah.
Ryuichi?
Smart man.
Well, I think it is important for organizations like Global Fund to have a large, complex evaluation, because we need to deal with the board and the donors. But what we do and why we do is for countries to reach to the people in need. So in that sense, it is very important to have a capacity in country and a high quality data system in countries. So that's what we are struggling for. Thank you.
Bob, anything to add?
I'll pass.
Carmela, last word?
I can't agree more with Deborah. I would really not like to sit at the end of this workshop. Surely there must be some way that we can move forward on that, because it's really frustrating, and I would like to see that as an outcome of at least a plan of moving forward, that we're not sitting here in another 5 years saying exactly the same thing.
With those notes, let me thank the panelists and thank you all, and we'll close panel one and get a cup of coffee.